Understanding the U.S. healthcare delivery system can be quite complex. It includes providers, settings, and purchasers. My name is Michelle Halby, and this is part of my RN to BSN program at McNeese State University. Nursing 302 is this class in Business and Healthcare under Dr. Williams. So why does the system matter? The U.S. healthcare system is a complex interwoven structure which is made of providers, care settings, financing mechanisms, and purchasers. Together, they actually determine who receives care, how quickly they receive it, whether care is safe and effective. Inequities persist still due to profit-driven decisions and regulatory pressures. Long-standing barriers, they include insurance gaps, racism, social determinants of health, and the digital divide. Healthy People 2030, they emphasize addressing these structural inequities. Access is not evenly distributed. In this presentation, I will walk through the major components of the healthcare delivery system and explain how each can reinforce or reduce inequity. Providers, who are they? They include physicians, nurses, advanced practice providers, specialists, and allied health professionals. Their roles include diagnosing and managing both chronic and acute illnesses. They coordinate care. They provide preventative services. Nurses play a unique role due to their proximity to patients and their families. They are often the ones who are closest to the patients and their families in many different roles: caregiver, teacher, advocate. Providers and equity. So nurses can help reduce these inequities by advocating for their patients, connecting the patients to community resources depending on their needs, their social determinants of health, participating in policy discussions to help change these policies to help the patient. Nurse-led community approaches, they address these real-world social determinants of health challenges. Provider advocacy is essential for addressing systemic barriers. Providers, unfortunately, unintentionally widen disparities when they overlook broader patient circumstances. A patient may have a treatment plan, but they don't have transportation, or they have a low literacy that prevents them from understanding instructions. Nurses help closely with that to help kind of close that divide. Setting. Where does this care happen? Happens in the hospital, that happens in outpatient clinics, physician offices, community care centers, long-term care facilities, home health, telehealth and digital care. Telehealth increases convenience and access for those with transportation barriers. Settings and inequity. So rural and low-income communities, they lack the special services and broadband access. The digital divide, it advances faster than reimbursement and regulatory changes. It creates this gap. COVID-19 made these inequities even more visible. Telehealth is still limited by broadband access, literacy, technology literacy in particular, reimbursement, and these regulatory gaps. Community health centers improve access by addressing these root causes of inequity. Multi-sector partnerships strengthen this community-level care. Telehealth expansion and state-supported clinics have also increased access in some areas. So who pays for the care? Who's purchasing this care? They purchase it through private insurance, employer-sponsored plans, Medicaid and Medicare, ACA and Marketplace plans, TRICARE and Veterans Affairs, out-of-pocket payments by the patient, and government agencies often influence coverage and reimbursement, such as the Center of Medicaid and Medicare Services, National Institute of Health, and Food and Drug Administration. Purchasers and inequity. So purchasers often determine what services are provided. They determine that what are the out-of-pocket costs, what's in their network, who's the provider that's actually in their network that the patient can see. The ACA expansion, they increase coverage and they use of preventative service. Evidence-based payment reforms, they supported equitable care. With all the changes, there's still financing barriers. There's high out-of-pocket costs. You often have to have a prior authorization. There's limited cover options. Not every state expanded Medicaid, and this still leads to persistent racial and ethnic inequities. The profit-driven financial system, it still can widen the gap. Equity-focused financing models in Healthy People 2030, it shifts resources toward high-need populations. To refresh, so understanding the U.S. healthcare system. It's made of providers, settings, and purchasers. Providers include doctors, nurses, healthcare professionals. Settings, hospital, clinics, telehealth. Purchasers, insurance, Medicaid, Medicare. There's still inequities, and we have strategies for the inequities. The whole point is we need to work toward equity and fair access for all. Conclusion. So the healthcare delivery system shaped by providers, care settings, and purchasers. Each influences access, quality, and equity. Structural barriers continue to affect marginalized communities. Nurses are positioned to advocate for equitable care. Progress requires coordinated efforts across clinical practice, community partnerships, financing reform, and digital innovation. These are my references.